If you have a back pain, you know how it feels. If you have elders at home, they may tell you your pain may be a sciatica pain. Yes, sciatica terminology is slowly vanishing from medical vocabulary, but it is so very well known and popular even now. I wanted to make a video of sciatica, and here is the result. It's a painful condition, often makes you stick to your bed and is unbearable. What is sciatica? How to cope up with it? What are the causes? Let's see in this video. Hello and welcome back. I am Dr. Arun Naik, a doctor for 30 years and a neurosurgeon for 20 years now. Dialogue with your doctor is called DocLog. In this channel, we have DocLogs related to brain and heart health, lifestyle diseases, cancer, spine health, and preventive health. We also give here simple, effective tips and tricks to put you on the positive side of your health. With that said, let's get started. Sciatica, well, is simply said, is the pain arising from your sciatic nerve. What is sciatic nerve? Sciatic nerve is the largest nerve in our body, which arises from our spinal cord in our backbone and comes down along our butt to thigh and supplies our whole leg. It is as thick as your little finger and it can be pressed at multiple places to cause sciatica pain. What are the signs of sciatica? Sciatica is a very popular symptom. Here, the pain flows from your low back through your butt area and into your lower limbs, all the way to your toes, and it is typically sciatica. Sciatica is the result of damage or pressure on your sciatic nerve. Along with pain, you may also have numbness or weakness in your legs or feet. In severe cases, you may feel like loss of feeling or movement. One typical symptom is the sensations of pins and needles in the whole leg, especially at night. One typical symptom of sciatica is inability to wear slipper or clogs, especially gripping the clogs between your toes. This is a serious concern as it means that you are developing weakness of your muscles. It's a red flag in the disease process. Rarely, you may feel difficulty in emptying urine or feces, which is also a warning sign. What are the causes of sciatica? As I said just now, sciatica is due to a compression of your sciatic nerve. The causes are usually serious, means you should never neglect your sciatica pain. One of the commonest causes of sciatica, especially in young adults, is herniated discs. Now, what is a disc? Friends, your backbone is not a single bone. It's a collection of 33 bones which are arranged beautifully in your body, forming two S-shaped curves. Between two bones or vertebrae, there is a gel-like material called a disc. This disc is a shock absorber for your body, absorbs all the bumps and jumps we have during our day. Well, usual number of vertebral discs is 23. You may have one less or one more, that's okay. When there is vigorous trauma to the disc ruptures. Trauma, I mean lifting heavy weights or jumping from the stairs or driving long distances. Once the disc is damaged, it comes out of its place and ventures near your nerves, causing compression. This is called sciatica, as we discussed. Just watch my separate video on slip discs and their management in my channel. Second cause of sciatica pain is spinal stenosis. In spinal stenosis, there will be abnormal growth of bones and tissues in the vertebral column, which leads to compression of sciatic nerve roots, causing pain. One typical symptom here is called claudication pain, which is difficulty in walking long distances. Third cause is a tongue twister called spondylolisthesis. Here, due to advancing age, the vertebral bones misalign with each other and pinch the nerves. This is, friends, is a serious condition. Now, what are the risk factors for developing sciatica? As your body ages, it becomes very likely that parts will wear out or break down. This is called spondylosis if it affects your spine and can cause sciatica. Certain jobs place a lot of strain on your back, especially lifting heavy objects, riding motorcycles, or sitting for extended periods of time. Yes, long sitting hours at your office puts a lot of stress on your back, causing weakness of discs and eventual slipping or twisting movements. Smoking can cause the outer layer of your spinal discs to break down. Yes, one more reason to kick that butt. Studies have shown that long-term smoking causes minor arteries supplying your backbones get blocked, causing weak bones and pain. And stopping smoking, friends, reverses the condition very soon. That's a good news for you smokers. When to seek medical attention for sciatica? In fact, sciatica or back pain is one of the commonest cause for a doctor's visit. Everyone has back pain for some days in a given year. So is sciatica. But when not to neglect your back pain? Friends, listen carefully. Any back pain lasting for more than 3 weeks should not be neglected. Don't neglect your back pain if you have back pain and that back pain goes to your butt and legs and toes. If your pain has tingling numbness feeling in the involved leg, don't neglect that symptom. If your walking is becoming difficulty, if your footwear is slipping from your foot, if you're passing urine in your clothes, don't neglect your symptoms. These symptoms are red flags in sciatica pain management. These symptoms, if you neglect, then there will be irreversible damage to your sciatic nerve. And friends, even if you take treatment, your symptoms will last forever. How to diagnose the sciatica? Friends, sciatica is a symptom, as I said, not a disease by itself. It just means that there is compression of the sciatic nerve. Nothing less, nothing more. When a patient comes to me with sciatica, I ask their symptoms, intensity of pain, associated medical diseases, smoking history, and most important, their profession. I do a complete neurological examination to see if there is any muscle is weak. Depending upon the condition, I may ask for a few investigations. Number 1, nerve conduction test. This is a simple neurophysiology test which allows us to measure the conduction in your sciatic nerve. If there is a delay, that means your nerve is under pressure. I may ask for an X-ray of the backbone or an MRI scan which will tell me what is causing the pain. Well, what is the treatment for sciatica? First things first, avoid that trigger for your back pain. Stop that gym workout, motorcycle ride, or that weightlifting. Earlier, we used to advise a few weeks of bed rest to give rest to the backbone. Friends, not anymore. In fact, long-term bed rest is no longer favored by many spine specialists. It is actually potentially harmful, making your recovery slower. If the pain is very severe, then I advise them to work from home. That too for about 3 to 5 days, depending upon the severity. I find that giving some rest to the backbone definitely relieves the pain straight. In most cases, my patients start normal, non-strenuous activity such as walking soon after. I teach them back exercises to strengthen the muscles of the back. This is probably the most important factor in preventing another episode of sciatica. I also start a few medications to relieve pain, some muscle relaxants to relax the muscles, and some medications to induce sleep. A pain relieving gel application along with hot or cold application will definitely help many patients. I advise ice packs during the first couple of days to reduce that swelling. After 2 or 3 days, I switch to heat. If you continue to have pain, try alternating between ice and heat therapy. It really helps, my friends. In some of my patients, I advise physical therapy involving many physiotherapy modalities like TENS, IFT, etc. 95% of sciatica pain gets relieved in about 2-3 weeks' time. In some cases, surgical management will be the only option, especially in slip discs and spinal infections. In patients with muscle weakness or urinary incontinence, I advise early surgery. Initially, I treat them with epidural steroids, which are given as outpatient procedure. In some cases, I advise surgery. Watch separate videos on my channel regarding slip discs, spinal stenosis, spinal arthritis, spondylolisthesis to know more about these conditions. Watch my channel for exercises designed specially for sciatica pain. With that, friends, we have come to the end of this video. I hope you like the content presented. Please like and share this video with your near and dear ones to put them also on the positive side of their health. If you are new here, please consider subscribing to DocVlogs. Hit that bell icon to get instant notifications of my new videos. If you ever had back pain or sciatica, please share your thoughts in the comment section. What measures you took, what treatment you decided, and how was the relief? Friends, I'll be back with another interesting DocVlog very soon. Till then, feel awesome, live awesome, and take good care of your health.